can't we just take any medicine or do a surgery to get rid of these little crystals in our ear? That's not as simple as it might sound. My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and vertigo-related conditions such as BPPV, also known as little ear crystals or positional vertigo. This is part 19 of my BPPV series where I will discuss medication and surgical options for people with BPPV. Reminder that this video only pertains to vertigo symptoms that is caused by BPPV. Vertigo symptoms can be caused by other conditions such as Meniere's disease and vestibular migraine, and that does not apply here. I hear the question from my patients all the time, can I just take medicine to get rid of my vertigo, or can't they just go in and remove those little crystals? Yes and no. Most medication options that we have only treat the vertigo symptoms themselves and do not address the mechanical problem, which is that there's free-floating little rocks inside your semicircular canals. A simpler to digest example of this is when you have a herniated disc in your spine. You may have a lot of back pain, and if you take a pain medication like ibuprofen, it may make you not feel the pain as much. However, it doesn't unherniate your disc. In the same way, vertigo medications will reduce your symptoms, but they don't get the crystals out of your canals. That's why these medications are often used in conjunction with maneuvers that do get the crystals out of your semicircular canals, like the Epley maneuver, to help you tolerate them better. Medications that can help mask the symptoms of vertigo include motion sickness medications, which help improve nausea and vertigo symptoms, anti-nausea medications, which reduce vomiting and nausea, antihistamine medications, which can reduce dizziness and nausea symptoms, anticholinergic medications, which will suppress vestibular activity, and beta-histine, which will improve blood flow to the inner ear. It should be mentioned that many of those medications will reduce the overall effectiveness of vestibular rehab, so make sure you talk to your doctor and your physical therapist about these effects. As far as surgical options go, there are 3 types of surgery that are reserved for really severe and chronic cases. These are not widely used because the results and the side effects are wildly unpredictable, causing things like permanently worsened vertigo or imbalanced symptoms or permanent hearing loss. These surgical options are almost never worth considering that more conservative methods like Epley maneuvers and medications are so effective. The first surgery is called semicircular canal occlusion, where the chronically offending canal is opened up and plugged up permanently. The second surgery is a vestibular nerve section, where a specific nerve that sends signals from the semicircular canals to the brain is cut, thereby destroying it. The third and most extreme surgery is a labyrinthectomy, where the entire inner ear is completely removed. This surgery always comes with permanent and complete hearing loss in the surgical ear. So as you can see, none of these options are as perfect as going in and removing those little crystals might sound. Get with your doctor about which treatment methods are appropriate for you.